Welcome to the NP POW videocast, a dynamic space where nurse practitioner experts will share their unique pearls of wisdom, or what we like to call POWs, on a wide range of healthcare topics. I'm your host, Dr. Julia Rogers, a certified nurse practitioner that is really passionate about advancing healthcare through knowledge and innovation. Today, we're thrilled to welcome Dr. Lynn Rapselber, who will join us to explore the exciting realm of entrepreneurship. Thanks for being here, Dr. Rapselber.
It's exciting to be here. Thank you for giving me this opportunity.
Well, we appreciate, and it is an honor to talk to you today. So I'll just dive right into the conversation. First, just tell us a little bit about yourself, your passions, and really what inspired you not only to become an advanced practice nurse, but also an entrepreneur.
Yeah, my story's a little bit interesting. I became an entrepreneur before I even knew the word entrepreneur. It actually started when I was a nurse. I was a nurse in the 80s working in a hospital, providing care to cancer patients. And the oncologist had approached me and said, it would be really great if we could do outpatient chemo. And in the 80s, that was kind of very innovative because the whole goal was really to look at how can we make the patients more comfortable by delivering their treatment outside of a hospital setting.
Yeah.
So I said, sure, the worst that can happen is it doesn't work out and I go back to the hospital, the pillar of job security. Well, I was at the practice for 20 years, so that tells you something. But when I was there, I had to learn about the drugs. I had to learn CPT, ICD, pricing out the treatments, how much labor, the equipment, everything involved in it. And then I also had to go to the insurance companies and negotiate a payment. So fast forward, as I'm growing this outpatient chemo practice, my skill set was starting to increase. And I said, I really should go back and get my nurse practitioner because I was doing that higher level functioning. I wanted to make sure I had the credentials to go with it. So I went back to school. And when I was at my training at the University of Connecticut, I said to my professor, are we going to learn about CPT and ICD? And this was in the mid 90s. She said, what's that? I go, oops, I think we're in trouble. And I don't even know what my capstone project was at that time. But I said, you know what, can we write something about the reimbursement process? And it got published in the May 2000 Blue Journal, the Nurse Practitioner Journal. And that really started me on my coding and billing and documentation journey. But then I realized, there's more to this. I think nurse practitioners need to start their own practices in order to advance healthcare and to change the trajectory of healthcare. And I ended up meeting Beth Chalek-Kaplan at Health Policy Conference for AANP. And I'm always very vocal about incident to billing and the invisibility for NPs. So I always talk about, let's get rid of this. And when I was speaking to her about it, she said, you got to meet my friends. And it was Dr. Lorraine Bach and Sandy Berkowitz, who's a nurse attorney. And the four of us got together and we created NNPen. So that's how we were born, basically from my connections with my other colleagues. Beth works for CMS. She recently left our organization. And then Sandy Berkowitz is a nurse attorney, dabbled in the insurance world. Lorraine Bach has been a practice owner since the 90s, different types of practices. And she's the proof of concept that you could have just about anything possible happen to you and still be standing and resilient as a practice owner. And then myself bringing the health policy, advocacy, coding, billing piece to the table. And I just recently started my own little practice as well.
That's awesome. You go back to the 80s, and I know just looking back with my own career in 20 years, so much has changed, and obviously pretty significantly since the 80s. We've come a long way. So knowing that you were among those pioneering NP leaders to take on this entrepreneurship role, walk us through that journey. You told us a little bit about how it started, but then how has it evolved over this time?
So our journey started in Boston with Northeastern University. We partnered with the dean and the Office of Innovation and Entrepreneurship, headed up by Rebecca Love at the time. And we put on a conference called Nurse Practitioner Innovation and Entrepreneurship. And we said, if a handful of people show up, great. We had over 100 people show up.
Wow.
And so I think we knew at that point that we were onto something. And that's when we formed a more formal operations for National Nurse Practitioner Entrepreneur Network. And we started with our flagship office hours, which we still do to this day. It's a 1-hour presentation on a hot topic that anybody can listen into, and all of those are recorded in our library for our members to have access to. But that was the flagship. And then we realized we had to put in pieces to break down barriers to practice. So we partnered with Collaborating Docs, health insurance. We partnered with Ben Advance. So we're trying to break down those barriers, and then partners with folks who understand nurse practitioners in the nursing model. So we partner with credentialers, billers, revenue cycle, and other partnerships that really engage and embrace nurse practitioners.
I love how you use the term breaking down barriers because, sometimes I notice with even new nurse practitioners, right? They also find their own barriers that they're trying to break down, but there's been barriers since the beginning of of practices. So if we keep breaking them down, eventually there will be less and less.
Absolutely. And I think that's the other aspect that we try to work on, is that collectively our voices have much more power than ends of one. So we're trying to identify practice owners and really work together to elevate what we're trying to do to change healthcare overall, because the nursing model is really that part of value-based care, that health promotion, disease prevention, keeping people out of the hospital, urgent care, and ERs. So I think that there's a lot of value that nurses bring to the table. And I know a lot of NPs, when they go into their training, really aspire to be a practice owner, but then they get through the program and I think it overwhelms them a lot.
Yes.
And there's really no talk in the programs about business. So I think in some ways they're stifled a little bit in that creativity and that passion that they had when they started their NP journey.
Well, and I also think that part of the dilemma is that not every state is the same. And so some states, like I live in Indiana, so we still have collaboratives agreements with physicians. And so I think that also plays a little bit of a dynamic role in whether someone believes they can start their own business or not, just depending on what those state regulations are.
Yeah, you're absolutely right. Those state barriers can be a barrier, but I'll tell you, it's so interesting that even states that have a lot of barriers, like Texas, for example, I went to their nurse practitioner conference, and many of them want and own their own businesses. And it's like you have challenges you have to overcome in a state like that, but they're managing to find ways to make it happen. And I think that speaks to the resilience of NPs in general, that we're problem solvers and we'll try to figure out a way to make it work.
Absolutely. And just their knowledge level to go on and do that. Explain the key mindset, really, or the mindset shift that a nurse practitioner needs to make when they're transitioning from having their clinical practice to becoming then a business owner.
I think the biggest thing is what is going to move the needle for you to start thinking about being a practice owner. It may be that you're disenfranchised with the medical model, the every 15-minute visit, the productivity constraints, the corporatization of healthcare. It may be that you have a passion in a particular disease state, or you offer a particular service that is appealing in the community that you're working in. Whatever's going to drive that and start that spark, that's usually what you need to have. Find a problem, find a solution. Then you have to find like-minded folks or folks that will get you to that goal, because we do not get business education and training, nor do our PA or physician colleagues for that matter. And you need the business foundation to understand how a practice works. There are many entities out there that'll say, hey, you just see the patients, we'll run your business. But if you don't know your numbers and how things work and what percentages they should be taking for, say, billing and all of that, you could be, losing a lot of money unbeknownst to you because you're not aware of what the foundational needs are.
Yeah, I think the purpose would be to grow, hire more nurse practitioners to be part of that practice. But you have to know about business in order to do that. There's a lot of different models out there. So can you tell us a little bit about different business models that are available? For example, direct primary care, concierge, things like that. And then how can the nurse practitioner determine what's the best fit for them?
Those are great questions. So we actually started a 12-week Business Basics Accelerator course. It's asynchronous during the week, so it fits into anybody's busy schedule. And then you do a meet on Zoom or a video platform weekly, and all the cohorts from across the country meet. And within these groups that we've put together, there's been some amazing practices that have spawned from it. a primary care for a mega church, direct primary care, a telehealth
Wow.
practice, many psych mental health opportunities. We had a nurse practitioner who had a van that she would go to patients' homes to do care, urgent care for kidlets, so they don't have to go into an office or an ER and be exposed to other things. We've had nurse practitioners that go and do house calls or home-based primary care. So it really is, what is the niche practice that you want to start and get started? And some will start small because they need to keep their day job for benefits or whatever. And so they can start their practice slow and build it up. We have others who are maybe started a practice, but are not quite sure if they're really doing it the correct way and want some guidance. So those are also folks that we help them figure out what avenue they need to go down to start their business. Some go in full force. They dive off the deep end and just go in. So it depends. And it depends on what your states will allow as well, because state practice varies and also business practice varies. So
Yeah.
in some states, I think Michigan, a nurse practitioner can't own a practice, only a physician can. So that puts
Yeah.
in a barrier that you have to work around. So knowing those things are also important so that you're not making a misstep in opening up and creating your business.
You bring up a really relevant point because I often think about this when it comes to telehealth. Because I live in a state that needs a collaborative physician, if I do telehealth and it's for out of state, you still, there's a lot of moving parts and dynamics. So someone who would want to own their own business and just do telehealth also has to be aware of all of the places and their rules and regulations if they want to be able to do telehealth in that state.
Exactly. And I also think that there are opportunities out there that NPs are being lured to help. And a lot of them may be ordering testing, for example, or prescribing weight loss medications, for example. Be aware and ask a lot of questions if you're going to partner with folks that are doing these things. Do they know what a nurse practitioner is? Do they understand the nursing model of care? Do they employ an NP in their business model that they're creating? And do they understand, or I have advisory boards of nurse practitioners that can help and guide them? What you don't want to have happen is that a nurse practitioner gets involved in a situation where they're ordering tests, for example, genetic testing, for example. That seems to be a big one from the Office of Inspector General, that people order these tests and they get a percentage of, if you write 100 prescription orders for this lab test, we will pay you X amount of dollars. The problem is if you're ordering a test, you need to have assessed that patient for the medical necessity of that test. You have to be the one to go back and review that test result with the patient. And if that's not happening, then that's considered fraud. And if you get caught in the Office of Inspector General, you could be excluded as a Medicare, Medicaid provider. And what does that do to your career? Basically, it's non-existent anymore. These are things people don't even think about when, they're looking at some of this, because they think, oh yeah, this is great. I'm going to help a lot of people by helping them diagnose their, genetic defects or whatever. And the long and short of it is you could be setting yourself up for some serious ramifications.
I was just going to give a very simplistic example of that. We weren't allowed to order diabetic shoes for right a long time, and no one was really thinking about that. We all took care of diabetic patients in our practices, but then we would have to have a physician to do that. So there's a lot of rules and regulations out there that I think that there's so many, it becomes overwhelming to know all of them. And so I'm glad to know that there is a space for people to go to understand some of those rules and regulations so that they don't get caught up into doing something wrong. Because I don't think anyone is intentionally trying to do something wrongfully. I think it's just lack of knowledge.
Absolutely. Absolutely. It is very much a lack of knowledge and a lack of understanding. And frankly, we just want to make sure that all of our NPs are getting good foundational support for their businesses, that they're feeling supported as they're building their businesses, and that we can grow and continue to advance the nurse practitioner and the nursing model of care delivery, because that's really, I think, where the public would like us. They like to develop a relationship with patients, which is what nurses do when we take care of our patients. That transactional model, the medical model, is really not people are not happy with it. They can't get into access care. They're basically treated like, a meat market. You come in next, you come in next, you come in next. And it's just very frustrating for patients sometimes too, to find care that they need when they need it by the right provider. So a lot of what nurse practitioners are trying to do is fulfill some of those voids in those care models and really help to get patients access to the care that they need, reviewing a lot of the care because we do that holistic care. So if you're with somebody and you're reviewing pharmacology, for example, all of their meds, I mean, you could probably see a lot of ways that you can impact their care, especially if it's an elderly person, by looking at their med list and seeing, what do they really need and what's causing some of their problems. Maybe they're experiencing side effects from the medication that we can address. But you can only do that when you're looking at that holistic health
Yes.
model, which we do.
Well, because it's become so complicated. I always say, when I first started as a nurse years ago, there was maybe 2 monitors in the ICU, and now there is like so many bells and whistles. And so I think it's just going to continue to become more technology savvy, right? So we all need to kind of come to terms to that and figure out how to do the best care, even though all of that other is also intertwined into that.
Absolutely. And let's talk about AI. I mean, AI
Yeah.
is now really taking over. And it's interesting. There's so many different platforms that are developing out there. And I think what I would like to see is AI be an enhancement tool for
Mhm.
practice owners to really help them be able to provide good care, but knowing where they can plug in AI to maximize their efficiency within their practices. I think that's where I would like to see AI.
Absolutely. I 100% agree with you. I think that it can be a tool that we use. It doesn't replace us. It doesn't have a human touch, but we definitely could use it as a tool to help us in our day within our practices. I'm also wondering how NP entrepreneurs can strategically position their practices to address community health needs while still building a sustainable business model.
That's a great question as well. I think one of the things that we're seeing is a lot of NP entrepreneurs getting into the cash pay space, which is great. I mean, you can make a lot of money, but when you think about the healthcare needs of people, it's really the underserved and underinsured populations that we do our best work in, and the Medicare Medicaid space. However, because of the way some of the reimbursement is happening with that, it really is very difficult for an NP to sustain a practice with just Medicare Medicaid. So what we're finding is a lot of folks are adding on some what we call side hustle opportunities, whether it's a weight management program or it's aesthetics or it's disability ratings for veterans or if it's employer-based healthcare. So there's some other aspects that nurse practitioners are adding into their practices so that they can maintain viability. When we start to aggregate more of our NP entrepreneurs together, then we're going to have a little bit more leverage to go back to some of these payers and say, hey, look, let's renegotiate these contracts. And we can have data to show that we're decreasing readmission rates, ER visits, and urgent care. And I think those are ways that we will be able, as a bigger collective, to make strides in changing the reimbursement opportunities that are out there for NPs.
Hence why we should not be billing incident 2, because you cannot collect data that there's no data existing for what you did when you're billing under someone else's NPI.
Incident 2 has been like my go-to whenever I do any talks. And I really tried, especially students, I try to tell them, when you go for an job interview, ask them how they're going to use your NPI number. Are they going to bill under your NPI or are they going to bill under the physician's NPI? And don't be shy about asking that because that's how you're going to know whether they're billing incident 2 or not. They may not tell you the truth. Sometimes you uncover it in other ways, but you're right. It makes the nurse practitioner invisible. And there's specific rules that Medicare has for incident 2 billing that you must follow. The first one is you're supervised by a physician, and none of us are under supervision. We're under collaboration at the worst or independent practice at the best. So again, that's one thing. The physician has to be either on site or available to answer any questions that you might have about that patient. They can't be a new Medicare patient, so the physician has to see them, develop that treatment plan. They can't have a new problem because that requires the physician to change the treatment plan. And then they have to be sharing that patient back and forth because obviously it's the physician who owns that patient. And a lot of times when I educate folks about that, I always present that right before break because invariably people will come up during the break and say, I think I'm in trouble, or I think this is happening to me. How can I handle it? And so it really opens up the door for me to have more conversations with folks. And I always tell them that if they're not following those rules, then it is fraud. And once you know, you have to do something about it, because, you can't put your head in the sand and say, oh, well, I didn't know. But if you know, you have to be more proactive for yourself and protect yourself. And sometimes it means leaving that job, leaving that practice.
This is something that you don't know. Years ago, I did listen to you speak, and because you saying something about Incident 2 and all of these guidelines that went along with it that I was completely unaware of as a brand new NP. And I think back to that because it made me have a crucial conversation with my collaborative physician about, hey, if you're billing Incident 2, and collecting on this is how this has to work. It can't work any other way. So even I am appreciative of your talks that you give about that.
Yeah, I think more and more people are interested in knowing about things like Incident 2 billing, because they understand that sometimes their productivity can be tied to this as well. So, the more you know about how they're keeping track of your productivity, for example, there should be open, transparent conversations within practices. And I know that sometimes that's not happening, but these are little ways you can open up that door and just, crack it a little bit, and it can start the conversation. Because again, you're responsible for what you document, code, and bill, not the practice. You are. So if they're doing something and you find out that you shouldn't be doing it, then the onus is on you to fix it.
Yes. Well, and speaking of lack of education, talk a little bit about how the current lack of business education in NP programs impact the success rate of nurse practitioner owned practices. And then a secondary question would be, what are the immediate steps that NPs as well as NP educators can take to bridge that gap?
Again, another great question. I really firmly believe that we need to integrate and infuse business education when we're baby nurses all the way up through, because I think that that's been a frustration along the way, because we really have no way of quantifying our value in organizations, which is one of the reasons why the Commission for Nurse Reimbursement is looking at taking the nurse out of the bed rate and putting them in as a line item in a financial institution's budget. Because when they say they don't have any beds, they're really saying they don't have any nurses. And then when they talk about wanting to cut costs, they're going to look at nurses as the cost center instead of a revenue generator. So, and they'll cut nurses, which is probably the worst thing you want to do in a hospital setting or an organizational setting. So that piece really needs to be integrated throughout our education and training. And then I think as we're NPs and knowing people want to go in to start a business, is really have some way of helping them during the course of their learning to understand more about business, and then maybe doing some sort of business education piece that could be added on to a program, for example. That's another way to get the word out. And in Penn, we designed a Business Basics Accelerator course to meet that need, because there is nothing out there, and it's taught by content expert speakers. So we have a revenue cycle talking about revenue cycle, a marketing person talking about marketing. So you're getting it from the experts in the field to know what you should be paying attention to and what you need to know as a business owner to make sure that you're going to be successful. So I think we need to plant the seeds younger as our younger nurses about business, but then carry that through all the way through when we become entrepreneurs.
Because as you said earlier, it is overwhelming to not only start a practice, but then if you are a brand new NP, then you're also, have a little anxiety about that. So sometimes it's hard to combine those two early on.
And the other thing too is seek out a mentor, find somebody out there who's doing, what you're interested in, and work with them, find out how they did what they did, and see, how you can do that as well. I think that's another thing. Or test your idea out on someone and say, hey, this is something that I'm interested in doing. Do you think I'm crazy? So those are some ways to start to look at whether you're on the right track to start a business or not. But I can tell you, we see problems and then we can identify solutions. It's just the operationalization of that we struggle with, because we don't know what we don't know.
It is really great advice to reach out and get a mentor. And I think that when you're new, certainly I felt this way. I shouldn't speak on behalf of everyone, but you're nervous about contacting someone that just seems so far out of reach for you to even speak to. But I think people would be surprised to know that if you just shoot somebody an email, I think that people are more than willing to help mentor you or give you some advice on which avenue to go. So,
Yeah,
um,
absolutely. A rising tide raises all boats. So if we
yeah.
can all work together, and I think that it's interesting because there was the phrase that nurses eat their young. But I think when you become an entrepreneur, you start to realize how much you need to network together and support each other. And again, it's also for the business aspect because if you're a primary care NP, you may have office space that you might want to share with a psych NP, for example.
Yeah.
That's a great way to conserve resources and partner together to sustain both practices because you'll refer back and forth to each other. So
Yeah.
there's a lot of ways that we can integrate a collaborative approach to business within our own communities to help support the community.
Absolutely. Finally, why should NPs really be thinking about entrepreneurship as far as, where do you see this guiding practice in the future?
Oh, I think we're poised to change healthcare delivery altogether. I think the medical model is unsustainable. We know that we pay way too much per person per year on healthcare, about $12,500. The next countries are about $8,000, Germany and Switzerland. So we have some work to do. But I think as we look at the value-based payment model, looking at how we keep people healthy, we have to stop looking at it as a transaction and more as a longitudinal care model, which nursing is. We develop partnerships with our patients. But you got to be able to understand of what you speak. So getting around people who are talking about these subjects, learn more about value-based payment models, understand more about business. I think those are ways that nurse practitioners can be a force to be reckoned with in the future. And I'm very excited to see, what we can do to advance healthcare and keep people healthy and stop talking about our poor outcomes and really celebrate good outcomes and keeping people healthy. I think that's what nursing can do, but we just need seats at the table. We need voices heard. We need to amplify our message.
Agreed. Agreed. Well, in your last few minutes, can you please share one or two POWs or pearls of wisdom with our nurse practitioner listeners that they could use and that you have found the most helpful or beneficial being an NP entrepreneur?
Don't be afraid because fear is a motivator. It's your success barometer. Two, know your resources. You can't know everything, but know who you can go to get the questions answers that you need. And surround yourself with like-minded people who are also trying to do the same thing as far as business ownership goes.
That's great advice, all of them, short, sweet, so that we can all remember it. So thank you. I
Great.
really have gained so much insight today, Dr. Rapselber. Your contributions not only have enhanced really our understanding of being an NP, but also how to be an entrepreneur. So I thank you for your generously sharing your time, wisdom, and POWs with us on the NP POW videocast today.
Well, thank you for having me. And if anybody out there wants to start a business, just push play and get going. You can do this.
Thank you. And thank you to all of our viewers for joining us today. I hope that you will return soon for more pearls of wisdom from our NP experts. Until then, this is Julia Rogers wishing you joy today and every day.